You know why you clicked on this video. Today we'll be talking about the anatomy of the male reproductive system. Male reproductive system, primarily 6 organ: testis, duct system, epididymis, vas deferens, urethra, accessory organs, seminal vesicles, prostate gland, urethral gland, external genital, penis, scrotum, testis. Description: film, mobile, organ, suspended in scrotum by spermatic cord. Measurements: length 5 cm, birth 2.5 cm, thickness 3 cm, weight 14 grams, covering vesicle layer of tunica vaginalis, covers testis and epididymis. Tunica albuginea, thick fibrous capsule, projects as mediastinum testis, dividing testis into 200 to 400 tubercles. Tunica vasculosa, oral vascular membrane lining individual tubercles. Epididymis. Description: C-shaped structure on posterolateral aspect of testis. Parts: head, body, tail. Function: site of sperm maturation and storage. Appendages: appendix of testis, lies under head of epididymis. A remnant of neuronal duct, also known as hydrated of Morgania. Appendix of epididymis, attached to head of epididymis. A detached modified efferent duct. A remnant of mesenteric duct. Blood supply of testis and epididymis. Artery supply: testicular artery. Venous drainage: testicle vein. Form: pumpeniform plexus, which reduces to a single vein. Right testicle vein drain into inferior vena cava. Left testicle vein joins left renal vein. Lymph drainage of testis and epididymis. Lymph vessels ascend in spermatic cord. They drain into lumbar lymph nodes at level of first lumbar vertebra. Vas deferens. Description: thin walled muscular tube, 45 cm long, conveying sperm from epididymis to ejaculatory duct. Course: ascends from scrotum through inguinal canal over pelvic brim, then descend on lateral pelvic wall, curves medially behind bladder, joins seminal vessel duct to form ejaculatory duct. Ampulla: dilated temporal part for sperm storage. Seminal vesicles: 2 elaborated organs about 5 cm long, located on posterior surface of bladder. The terminal part of vas deferens lies on the medial side posteriorly. They are related to rectum. Each seminal vesicle narrows inferiorly and joins vas deferens to form ejaculatory duct. Each consists of a highly coiled tube embodied in connective tissue. Ejaculatory duct each is less than 2.5 cm long, formed by union of vas deferens and the duct of seminal vesicle. They pierce posterior surface of prostate, open into prostatic part of urethra near prostatic utricle. Their function is to drain seminal fluid into prostatic urethra. Prostate: a fibromuscular granule organ surrounding prostatic urethra. Size: 2 x 3 x 4 cm. Weighs about 20 grams. Location: lies between bladder, neck and urogenital diaphragm, enclosed by fibrous capsule, cone shaped with a base and an apex. The 2 ejaculatory ducts pierce its posterior surface and open into prostatic urethra. Prostate lobes: the prostate is incompletely divided into 5 lobes. Anterior lobe lies in front of urethra, devoid of granular tissue. Medial lobe: wedge of gland between urethra and ejaculatory ducts, reaching glands. Upper surface related to bladder trigone. Posterior lobe situated behind urethra and pro-ejaculatory ducts, contains granular tissue. Right and left lateral lobes lie on each side of urethra, separated by a shallow groove posteriorly. Contain many glands. Prostatic urethra: 3 cm long, starting at bladder neck, passes through prostate from its base to its apex, becoming continuous with membranous urethra. It is widest and most dilated part of entire urethra. Features a long ridge on its posterior wall called urethra crust. On each side of urethral crust is a prostate sinus, into which prostatic glands open. At the summit of urethra crust is prostatic urethra. At the depletion, ejaculatory ducts open at its mouth. Function of prostate: the prostate produces a thin milky fluid containing citric acid and acid phosphatase. Smooth muscle surrounding glands squeeze this secretion into prostatic urethra during ejaculation. The prostatic secretion is alkaline and helps neutralize vaginal acidity. blood supply of prostate, arteries, branches of inferior vesicle and medial rectal arteries, veins from prostatic venous plexus, which receives deep dorsal vein of penis and vesicle veins and drain into internal iliac veins, lymph drainage, drain to internal iliac nodes, nerve supply, innervated by inferior hypogastric plexuses, sympathetic nerves, stimulate prostate's smooth muscle during ejaculation, urethral glands, paired round glands 3 to 5 mm in diameter, located in urogenital diaphragm, empties into proximal part of penile urethra, composed rubricals with mucosa secreting simple columnar epithelium dependent on testosterone. During erection, they receive a clear mucus-like secretion containing carbs. This secretion coats and lubricates urethra lining in preparation for sperm passage. Penis has a fixed root and a free-hanging body. Delivers sperm into female reproductive tract. Structures: root, shaft, glans, penis. Precuce: root of the penis, composed of 3 masses of erectile tissue. Bulb of penis and right and left crura. Bulb midline attached to undersurface of urogenital diaphragm, traversed by urethra, covered by bulbospongionisis muscles. Crura attached to side of arc, covered by ischius cavernosus muscles. Body of penis composed of 3 cylinders of erectile tissues enclosed in buccal fascia. Erectile tissue, 2 dorsally placed colpa cavernosa and a single ventricle colpus spongiosus. Glands, penis, expansion of colpus spongiosus at its distal end, covering end of colpus cavernosa, external urethra, meatus, slit-like urethra opening at testis, glans, penis, prepuce, hood-like void of skin covering glands, connected by phrenium supported by suspensory ligaments of penis, which extends from linea alba and symphysis pubis. Blood supply of penis, arteries, colpus cavernous, supplied by deep arteries of penis, colpus spongiosus, supplied by artery of bulb. Also, the dorsal artery of the penis is present. All these arteries are branches of internal pudendal artery. Veins drain into internal pudendal veins. Lymph drainage, skin of penis, drained into medial group of superficial inguinal nodes. Deep structures of penis, drained into internal iliac nodes. Nerve supply from pudendal nerve and plexuses. Scrotum, an outpouching of lower anterior abdominal wall, contains testis, epididymis, and lower ends of spermatic cords, described as a medial pendant pouch of loose skin and superficial fossa. Features a median levy that divides it into right and left compartments. Left side typically hangs lower than right. Maintains testis at about 3 degrees lower than normal body temperature. Covering of scrotum, skin, superficial fossa. Contains dartos muscle. Fatty layer is replaced, and scalpus fascia becomes coarse fascia. External spermatic fossa derived from external oblique muscle. Cremasteric fossa derived from internal oblique muscle. Internal spermatic fossa derived from fossa transversalis. Tunica vaginalis, a closed sac covering anterior, medial, lateral surfaces of each testis.